At an increasing rate, cannabis is sending consumers to local emergency rooms. We dug into the issue to find out why. As the strength of the THC in cannabis has skyrocketed, so has the need for a trip to the ER for some that partake.
There's definitely an uptick.
When compared with people who don't use, cannabis users were 22% more likely to end up in the ER. Emergency physician Dr. Roger Martinez sees it firsthand.
Typically it'll be something psychiatric, anxiety, agitation. Sometimes they'll have chest pain or they'll have palpitations, nausea, vomiting.
With pot legal in 19 states, many cannabis users just don't know how much stronger marijuana has become with higher levels of THC, the psychoactive component in cannabis.
Not only the high is more, but also the potential side effects can be more extreme.
Decades ago, the THC level was 2 to 3%. Today, anywhere from 15 to 30%. Studies show this highly potent cannabis can increase the risk of anxiety, depression, and suicidal ideations.
I didn't know that it can cause psychological issues.
You see a lot of people who have never taken cannabis before. It's the whole spectrum.
Is it?
All the way up to 80 years old, from kids to in their 80s.
Typically, patients are treated with gentle sedation, IV hydration, and time.
And they're just like, you know what, I didn't expect that. I don't think I'll ever do it again.
When taken excessively, this much more powerful cannabis can also negatively impact a developing brain.
A study out in New Zealand showed that heavy marijuana use in adolescents will shave off about 6 to 8 IQ points. Doesn't sound like a lot, but that's the difference between an A student and a B student.
Doctors say moderation and knowledge of the drug's strength are the keys.
So the edibles are kind of scary because they look like candy and brownies, and so you don't know.
But 50 milligram edible will look the same as a 5 milligram. So you really have to look at the dosage.
Over 22 million Americans used cannabis last year. Most did not end up in the ER. Marijuana also has medical benefits. For example, treating seizures or inflammation.
Marijuana has some legitimate medical uses. It's great for insomnia. Sometimes people use for anxiety, anti-nausea, pain reduction. So yes, in moderation, if you use responsibly, can help a lot of people.
However, the risk associated with higher THC levels needs to be communicated to the public, especially young people.
It definitely would help if there was more information and education to the general public about it.
We'd have to talk to her and hope that we have an open and honest relationship and let her know that she can come to me and just have a conversation.